Okay. Hi everyone. As it happens, Fiona and I, we choose the same paper, so we are happy to present it together to you. And this paper is pretty old. It was published in 1948 in the New England Journal of Medicine by Sidney Farber and his colleagues, and the title is Temporary Remission in Acute Leukemia in Children Produced by Folic Acid Antagonist Aminopterin. Okay, I'd like to give you some medical background. So in the 1940s, the morbidity was mainly, the main cause for the morbidity was infectious diseases such as TB, hepatitis, polio, pneumonia. In 1940, the rhesus factor was discovered. Then in 1946, penicillin was widely available. And but looking at cancer, in 1936, in children, cancer was the 9th leading cause of death. But after the introduction of the antibiotics, it rose to the 2nd leading cause in children. Then in 1940, there was the first ever textbook of cancer in children. But during these days, in the 1940s, childhood leukemia was inevitably fatal. So the treatment mainly was reduced to giving red blood cells and antibiotics. Survival was stated with some weeks, maybe 2 months after diagnosis, but nothing more. And I found one sentence which I found really representing this devastating situation. So it says, caring for a child with cancer was usually of short duration and focused on helping the child and the family to face inevitable death. So this was the situation. So pediatric oncology did not exist. There were no treatment options for these patients. And at this time, there was Sidney Farber, the main author of our paper. He was an American Jewish pediatric pathologist who was born in 1903. He graduated from University of Buffalo, and during those days, Jewish students were often refused admission to US medical schools. That's why he had to go to Germany. He went to Heidelberg and Freiburg University in order to be able to enter medical school, and then after 1 year, he went back and was allowed to Harvard Medical School. He completed a postgraduate program in pathology at a children's hospital in Boston, and even then he was known for his extremely meticulous and precise scientist and his very, very tidy laboratory. He then became professor of pathology at Harvard Medical School, and during his whole career he published more than 270 books and articles, and he had many different areas of expertise. So he did some research in cystic fibrosis, celiac disease, some rare membrane diseases, encephalitis, granuloma, meconium ileus, and even in sudden infant death syndrome. There even is one disease which is named after him, the Farber disease, which is a rare lipid storage disease. He was a lifelong advocate for cancer research in general, and he died in 1973 from cardiac arrest while working in his office. So he was very dedicated to oncology. Okay, so this is the background, and now we go into the paper.
So the groundwork for this particular paper already started in the 1930s when Lucy Wills discovered that yeast and liver extract could miraculously restore normal bone marrow function in patients with leukemia and anemia. And she also managed to extract the substance which was responsible for that, and it was then called Wills factor, and later on became known as folic acid. And the next important person to come into that play was Yelapragada Sabaru in 1946. He was a chemist, and he was the first person to manage to synthesize folic acid. But he got even more creative and did not only synthesize the original folic acid, but also some things structurally a little bit similar, some on purpose, some by accident as side products. And then he also found out that some of them worked like folic acid, but some of them seemed to work exactly the opposite, so block the effects of folic acid. And then Farber, the pathologist, got interested in folic acid because he also discovered that treating patients with folic acid deficiency, but it was at that time not known that this was the cause. He just saw the very big erythrocytes, and he found out or discovered that when you treat them with folic acid, normal bone marrow function is restored and the patients become less anemic. So then he thought, since pediatric ALL, which is an incurable disease, also originates from the bone marrow, why not treat ALL patients with folic acid to restore normal bone marrow function? He did. And then the following happened. The patients were not cured, but the patients progressed and died even more rapidly. So he concluded that ALL cannot be treated with folic acid, rightfully so. But luckily enough, his conclusions did not stop there, but he then further thought, what if, when that happened, what if that means that if we treat patients with folic acid antagonists, we might have a chance at curing them, or at least stop disease progression for some time. So he contacted his friend and colleague Sabaru and asked him to supply him with biological folic acid antagonists. And he first did not dare to give it to a cohort of patients because he learned from his previous mistake, but he gave it to one patient who was really terminally ill and had severe symptoms, and he gave him daily, at this point, Aminopterin, and the boy miraculously went into remission, something that has never been seen or documented before. And he then got encouraged and treated 16 additional patients, and the results of this treatment period was published in the New England Journal of Medicine in a paper that I think we all know. Here is the data of the particular paper summarized in a table that was published later on as a tribute to Sidney Farber. And now you might wonder, there is 5 patients published, but I just said there were 16 patients treated. There were 16 patients treated, 11 of whom responded. He published 5 of them, and he only published the 5 patients as a combined case report that showed the best treatment results. So very important paper. We might argue about the methods a little bit. As you can see, he did not only give Aminopterin, but he had also no real proof of concept. He just gave any folic acid antagonists, and if one didn't work, he gave the other. These are the patients that actually received the folic acid, the Aminopterin, and showed the best response. So the limitations of the study, I think we don't really need to talk about that. I don't think that this paper would be published today, probably not in the New England Journal of Medicine at least. It was a combined case report with no real proof of concept and with some biased data report. But even then, it was, even though it was published in the New England Journal, met with skepticism. But the skepticism got quieter and quieter when 2 out of the 5 patients reported actually remained alive at 16 and 23 months after diagnosis, which was completely unheard of in a very rapidly fatal disease. And then the skepticism actually quieted down completely and turned into praise when he published a follow-up article with 60 patients in 1949, showing a more than 50% remission rate with Aminopterin monotherapy. And the praise could not be better summed up than in a Blood article published in 1950, where it says, "It appears that the folic acid antagonists, although by no means curative in acute leukemia, offer the first ray of hope in the treatment of this disease and may be the precursors of more effective and less toxic drugs. Thus, the results of therapy may be said to represent the beginning of a new era in the therapy of this dread disease. They also lead support to the thesis that in chemotherapy may lie the fate of the ultimate control of cancer and related diseases." And personally, my reason for choosing this paper is because I am convinced that we cannot advance if we forget our origins.
Okay, now more to the present. As consequences of this work, this was seen as the first successful use of chemotherapy in cancer. So research into chemotherapy agents for different types of cancers really started at that point, and pediatric oncology was established. So specialized pediatric oncology units, treatment protocols, all followed step by step. And with this, the survival rates improved. Then Faber, he founded the Children's Cancer Research Foundation, which after his death was renamed as the Dana-Farber Cancer Institute, and it still exists until today, and even last year it was rated as one of the world's best cancer hospitals, and for example, imatinib was discovered there. Aside from this very important work, Faber also discovered that actinomycin D and postoperative radiation can effectively produce remission in Wilms tumor, so another important aspect of his work for our field today. And as you can see, in 1965, worldwide, there were 71 children with ALL that had survived for more than 5 years. And the long-term survival of all children malignancies at that time still was at about just 20%. So in summary, you could say that without his paper, we might not be meeting here today, or at least he laid the groundwork for our whole specialty. So it's a very important paper to remember. Thank you.
Thank you. Any questions?
So here's my question for you. Do you think you would be able to do this trial today?
Not with these circumstances, absolutely not, no.
It would not have been, who would have given you no approval? No funding, no IRB approval, no, all of it, right?
No way, no.
Well, but it's an inspiration to be brave and bold in finding new treatments. So thank you for selecting the paper.